Botox. Botox is botulinum toxin, and what it is, it's a toxin that we inject into the muscle to cause paralysis of that muscle. So we have forehead lines, we have frown lines, and we have crow's feet, or we have smile lines. Now, Botox is a toxin that you inject. It lasts for 2 to 4 months. It does not change your life, but it does make you look fresh for a few months. And then you have to repeat it again. And then you have to repeat it again. I'm not a big fan of Botox because at the end of the day, what you can do is you can actually tighten your forehead by resurfacing your skin and treating your skin so that you can reduce these fine lines and not go to Botox every few months. So for me, Botox is a quick fix before a special wedding or an anniversary or an event. So that's the first thing, and especially when my young girls come in or my young females come in, they ask for Botox. I'm like, okay, let's use something else. We can actually tighten your skin cells so that you won't have expression lines. And it's always nice to have some kind of expression lines. But here's the thing, if you really want Botox, these are the things you need to look out for. First thing is first, you never want to be injected below the lower third of the forehead because this will happen or this will happen. And I know a lot of people they come in and they ask for, Dr. Vali, can you just raise this? Kendall Jenner has it. Can you just raise it by 1 millimeter? Or the Victoria's Secret models have it. Can you just raise it a little bit? If I keep using Botox to raise your brow, and you have a twin sister who hasn't used Botox to raise her brow, what happens with Botox is it raises and then the botulinum toxin disappears and the brow falls. And with time, if your twin sister hasn't had it and you've had it, your brow actually comes down much lower. So my advice is stop using Botox to raise your brow. I see a whole group of ladies or men and they have nothing here with minimal movement, but over here when they smile for me, superstar, they have lines coming all the way down here and in this area over here, but yet they're completely clean here. What's happened is your doctor's forgotten that this is a round muscle, orbicularis oculi. And what he's actually done, or she's actually done, is she's just injected the lateral fibers and he or she has forgotten to come into the inferior aspect of the round muscle or into the nasalis, the nose here. Remember, all muscles act synergistically. What comes up must go down. So you can't just paralyze one muscle. If I paralyze the frown, your frontalis, your horizontal lines will get stronger. If I paralyze this, your frown and this muscle will get stronger, which means these lines will become stronger. So if I've just paralyzed this muscle, and this is a round muscle, and I've only paralyzed the lateral crow's feet, this is still working. And this is why you have all these fine lines when you smile, but yet you're clean over here. So always make sure that your doctor assesses your musculature anatomy correctly, because we all have different anatomy, and then injects you correctly. Even if you're just wanting to have your frown done, you should still put baby units everywhere else, and especially coming into this area and here, because you don't want something called reactive lines, new lines forming from over paralysis in other muscles. Other areas you can use Botox in is in the lower part of the lower half of the face. However, you have to be very careful when you're using Botox in the lower half of the face, because if you do not isolate the muscle correctly, you can end up with a wonky smile, really downturning of the nose, or like massive asymmetry of the face because you've injected the masseter or these muscles incorrectly.